Let's return now to Samoa, where the death toll from the measles epidemic has risen to 39 following the deaths of 6 young children overnight. For the third day in a row now, the number of deaths has continued to rise as the government races against time to vaccinate the entire population. Our reporter Alex Perrottet and multimedia journalist Logan Church arrived in Samoa late this afternoon, and Alex joins me now. Alex, what's happening there?
Well, we're just outside the Tupua Tamasese Meaole Hospital in Apia, that's Samoa's capital, as the sun's gone down. Nice evening breeze, although they did say it was a hotter day than usual. It was a little bit eerie outside the hospital, rather quiet, and I don't think it's an exaggeration to use the word fear. We saw a number of families in their cars, one couple with an infant on their lap and 2 young kids in the back of the car, all with face masks on, looking very concerned, talking to authorities. Not too sure whether they were admitted here at the hospital. But certainly there is concern and there is fear because this death toll is rising. As you said, 6 overnight. We're at 39 deaths from measles in Samoa and almost 3,000 cases. Again, that critical age group, 1 to 4 years old, there are over 900 kids in that age group that have measles, so we're going to watch the numbers and we're going to hope and pray that the deaths don't continue to rise. We're here outside the Ministry of Health actually, and we wombled in and happened upon the CEO of the ministry, the Director of Health, that's Lea Usa, Dr. Takena Seri. He was just alone at his desk. We'll be talking to him at more length tomorrow, but he did look tired, and he did say that the nurses and the doctors are tired. They're expecting more to come in from overseas, including New Zealand.
So what more can you tell us about the vaccination program and whether it's working for the target age that they're trying to reach?
That's right. Well, here at the hospital, Lisa, this is kind of the main centre where people are coming in to get immunisations. As you can understand, it's the capital here. But the concern for children are right around the country in the villages. And so there are mobile units. We've talked to the person that's coordinating that. So there are 18 mobile units that go out every day. They're actually just waiting for the last of them to come in at the moment. And they're going to regroup at 7:30 in the morning and send them all out again. There's 5 in each team. That's 2 vaccinators, a data person, someone who's recording everyone who's getting the jab, as well as a police officer there for security and a driver. So they're going out in 18 different vans. That's 90 people around the country. They're the mobile units taking those immunisations around the country. Really, really important because, as we said, 900 people aged 1 to 4 have this disease, and that is the category of the lowest uptake of vaccinations. The fear I was talking about before comes from the scare last year where 2 children died after human error, where 2 nurses mixed the wrong vials and those children died. That sent vaccination rates plummeting. They were already low. The effort now is to try to convince them to instead not be afraid of the jab, but be afraid of what's happening if you don't get it, which is deaths, 39 and counting. Lisa, this is already a tragedy. Just how much a tragedy it's going to be will be seen in the next days and weeks.
That's Alex Perrottet, our reporter on the ground in Apia. He's there with our multimedia journalist Logan Church, and they will be reporting from Samoa on that measles epidemic over the next few days.